Hello, myself Saileja Kaur, and the country that I choose for my poster presentation is South Africa, and the condition is hypertension. The normal blood pressure of humans is 120 by 80, and when the systolic blood pressure is 140 or above, and diastolic is 90 or above, then it is considered as high blood pressure or hypertension, and it is considered severe if the blood pressure is above 180 by 120. When the blood flow against the wall of the artery is very strong, then the condition is known as hypertension. And talking about South Africa, 65% of the individuals residing in South Africa over the age of 60 years, that is elderly population, are considered to have hypertension. They are, and almost half of them don't use any medication because there is lack of awareness or they refuse to take a medication. As per the survey, among the 8 health facilities present in South Africa, follow-up was done over the period of 3 months, and 8,948 patients with chronic diseases were recorded, and among those patients suffering from chronic diseases, 60% of them had hypertension. So, over the time, if hypertension is not treated, it can lead to various chronic diseases, which might be heart disease or stroke. And talking about hypertension in Australia in 2015, only 5.8% of the diseases were caused as a result of hypertension. So it is comparatively low as we compare to South Africa. And 1 in 3 people above the age of 18 have hypertension. Hypertension is more in men than compared to women, and from age group 85 or above, the hypertension rate is high. We can see in the chart that hypertension percentage in men is comparatively higher than in women. Some of the major factors that cause hypertension is generally related to our uh, lifestyle and our body buildup. The people who are obese and who don't do any physical exercises and who consume more alcohol and junk food, who don't have a healthy diet, are more vulnerable to hypertension. And hypertension family history also plays a vital role. If your family members suffer from hypertension, you have a family history of hypertension, then um, you are also likely to have hypertension. There is high risk, so we can say that family history also plays a vital role in hypertension. And talking about obesity in South Africa, obesity is the major factor causing hypertension in South Africa. And a survey was done among the hypertensive population. There were 300 people who were aged 18 and above, and they all were hypertensive. And as per the survey, 75% of them were black. The BMI of the black population is higher, and among the black also, the women have higher BMI as compared to men in South Africa. The body mass index and obesity. The obesity in women was 6.5 times, almost 7 times higher than in men. And similarly, hypertension was also found to be 1.4 times more in women than in men. So we can conclude that hypertension and obesity both were higher in women in South Africa as compared to men. Talking about obesity in Australia, out of 11,000 patients in the year 2005, only about 22% of them had obesity. Obesity is also one of the major factors in Australia, but not all obese population have hypertension. People in Australia have more access and knowledge regarding hypertension and obesity and how to tackle with that, and regarding healthy lifestyle also, they have all essential information. And talking about the nurses in South Africa, the nurses demand is very high, which has not been met, and per thousand population the nurse density is only 4, but in Australia, the nurse density is higher than in South Africa. It is 10 per thousand population. And in the year 2004, South Africa had over 35,000 enrolled nurses and 94,000 nurses who had completed a 4-year nursing degree, who were considered to be the nursing professionals. So, the nurses have been increasing every year, but still the nurses' demand is has not been met, uh, as the nurse density is still low. In 2011, in Australia, the total number of nurses and midwives collectively was found to be 330,680, and the number has been increasing every year. And nursing density is also um, 10 per thousand population in the year 2011. So we can see that the nurse density is higher in Australia, and people have more access to health facilities and all. Thank you so much for listening. Thank you.